Welcome to our Friday special. This particular program's topic happens to be a very unfortunate report that has been printed by the UNICEF. And in that report, it says that Pakistan has the world's highest newborn mortality rate. And that's even ahead of some sub-Saharan poor countries that may be affected by famines and such natural calamities as well. So it's quite a worrying report. And to talk about this report, we have in our studios esteemed guests. First of all, let me introduce Dr. Kennedy Ongwae. He is the Chief of Health UNICEF in Pakistan. Along with him, we have Dr. Saqlain Ahmad Gilani. He is the country head for the expanded program on immunization. Welcome to our studios,
okay,
sir.
Thank you. Thank you.
I'll start with you, Mr. Kennedy. Pakistan's highest rate of mortality among many other countries, 22 babies, one in every 22 babies happens to lose his life. What does that say about the state of affairs in Pakistan's health sector?
So I think basically let me start with the report. It's an estimation of the mortality, which a group of agencies, where UNICEF is one of them, conduct on a regular basis. That group is called UNICEF, or United Nations Interagency Group Mortality Estimation. And what happens is that they look at data from different countries, and then they look at the trends over time and do the estimate. And these are what the estimates which form the basis of a campaign which is called Every Child Alive campaign, which was launched globally on 20th February in New York. This campaign is portraying or highlighting 10 countries that are thought to collectively have the highest number of newborn deaths in the world, and Pakistan happens to be one of them. Now, you ask the question on what that says about the healthcare system of a country. Now, to save newborns from death, of course, you need a good health system with skilled manpower, that's the people. You need a system with a place where services can be accessed, and those are the healthcare facilities. And you need, those facilities, they need to have products which are proven or which are useful in saving the lives. And lastly, the communities, the women, the young mothers who go for those services need the right information, need to be empowered with what they need to know so that they can go for those services or take the children or even take the newborns at the earliest instance of suspecting that there are complications. So a combination of all those three P's, let me call them the three P's, the people, the place, the product, and the empowering of the communities, is what constitutes healthcare and is a product, or is what produces good health, or is what produces unfavorable health. Now, if you look at Pakistan, definitely, having been here for more than a year now, there is a lot of investment which is going on into the healthcare system. And as you are aware, since the 18th Amendment, health is a provincial matter. So when you go to some of the provinces, you see very clear focused investment into the healthcare system. They are employing more doctors. They are clearly investing into strengthening their provincial health commissions. More vaccinators are being recruited. The ready health worker capacity with support of UNICEF and other partners is being improved so that the chances of having newborns born to survive and thrive are increased. So that's the situation which we have in the country. And unfortunately, the report and the way it is produced, those are the figures it's giving us. Now, you seem to be kind of comparing Pakistan and other countries. Countries are not the same. We are talking about a population of 207 million using the latest estimate.
Yes.
The countries you are talking about from Africa are small. Some of them have populations of less than 10 million with very small geographic areas.
Right.
So the context here is not the same.
All right.
So even the report and the outcome of that report does not allow compulsion between countries.
Okay.
It's basically a reality check, and which basically means we need to look at.
So it's not
Pakistan.
really a comparison between countries. It's just telling them that this problem needs to be appreciated or understood and then addressed according to the country's own capacity.
Context, yeah, exactly.
Okay, that's a very important aspect that you've mentioned. When we talk about that, Dr. Saqlain, in your opinion, what has Pakistan really done in order to improve the health sector when it comes to pregnant women? And also when we talk about lady health workers, they also play a role in improving the overall health of our society. If you could talk a little bit about their role in improving Pakistan's health sector.
Thank you very much for inviting us in this very important program. You know, as Dr. Kennedy has talked about regarding this report, that Pakistan is the one of the country who have the highest rate of the infant mortality in the world. And certainly that would have been alert for the country. In regards what you have talked about regarding this role of the LHWs or some arrangements like improving the availability of the service for the pregnant women. So I just want to talk that yes, this had been very important area in the past time and now. And if you see in the last 3-4 years, there was no such really arrangements available for pregnant antenatal care, and then the
Postnatal care.
new antenatal and postnatal. You know, because you know in the antenatal care we have to look around regarding the issues which could happen.
Right. So it's a
before the
preemptive
delivery, before the delivery of the children.
Right.
So now, after the delivery of the children, there are certain. I just want to add in here that there are many factors. You have, discussed with Dr. Kennedy that there are many factors who are playing its role in increasing the rate of the death in the newborn children. But one of the area is the vaccination to the children, and not only to the children but also the mothers. Who, you know, in Pakistan, although the hospital deliveries are improving more and more, it has become more than I think 60 or 70% now. But still, there are certain deliveries which are happening at home or some hospital which
Rural areas.
In rural areas. So that we need actually have to have protection against the tetanus for the women and the newborns. So the immunization is basically playing its very important role. And through this forum of the immunization, in all the country, you know, we had improved in HR, we have improved in the infrastructure, we have improved the trainings. So the things are becoming better than the past. And the role of the LHWs, we have involved the LHWs in particular in immunization, because you know this awareness and the communication between the community and the service delivery people is very important. So now the LHW has been trained with the support of our donors and partners in the country, UNICEF and WHO, to basically involve them in awareness and social mobilization. But also we have involved them in delivery of the services.
Well, I'm glad you raised the point about educating the masses when it comes to immunization. There is, in many parts of the world, there are concerns that vaccinations may cause other complications or that they might damage the fertility of individuals. So would you like to dispel these myths and what are the problems associated with this? Why does this myth exist in the first place? If you could talk about that.
Thank you very much. I think this is very important point, and I would have this opportunity through your forum to let the people know actually this misconception or the myth which is really not
true. It's
in
not
reality.
true.
So vaccines are basically to save the lives, and that has no such effect on the fertility or something like on the births. So I think the vaccine would have some effects, but it's more weight to give vaccination to the children and to the mothers to save them some deadly diseases. So this is totally wrong concept that they would play in something role for the fertility and stopping the birth rate.
Okay, Dr. Kennedy, if you could talk a bit about UNICEF's role in Pakistan and what have their experiences been, what have they learned, and what would they like to share after whatever they've learned with their Pakistani hosts.
Yeah, thank you very much. I think UNICEF has been in Pakistan since UNICEF as an agency came into existence. It has been in this country.
Yes.
Because UNICEF is a development partner which works and supports government efforts.
Right.
And just to add to what Dr. Gilani said, when it comes to neonatal survival, Pakistan, and in particular, when you look at the issue of eliminating maternal neonatal tetanus, that has been eliminated in Punjab province, which is a half of the population of Pakistan.
Right.
Sindh province is on the way with pre-validation and validation. Same for KP, planning, and then Balochistan, and then the other federally administered areas will follow, which have much smaller populations. They will follow. What that basically means is that as far as tetanus is concerned, maternal neonatal tetanus, as far as tetanus as a threat to neonatal survival is concerned, that risk has basically been reduced by almost 50% in Pakistan. And that used to be a main cause of neonatal death in this country, and just as the way it is in other countries where maternal neonatal tetanus has not been eliminated. We play a role in that elimination, but the government has the biggest contribution to make because they manage the health system.
Yeah, my question was that what kind of support have you witnessed in terms of helping these marginalized women who have problems delivering their babies? Do you see that the provincial governments are living up to their responsibility?
That's where I'm coming. So that's why I started with tetanus, because that's a preventive action,
okay,
which helps to save newborns later. Now, when it comes to saving newborns who have complications or ensuring that mothers have a safe delivery, over a short period, in the past 1-2 years, I've witnessed increased investment into maternal newborn programs. Just to give you an example, in 2017 alone, working with the governments in the different provinces, we managed to establish 38 sick newborn care units. These are units which are specialized for saving newborn lives, and they are normally located at district headquarter hospitals or at the main referral hospitals at the province level. In 2017 alone, these units, the 38 of them, managed to serve or benefit about 17,900 sick, severely sick newborns, and about 80% of them survived. That investment in those areas which are making a difference, we are seeing provincial governments putting in their resources to move that direction. And as we speak, I'm aware of one province which is actually developing a PC1. PC1 is the financing mechanism specifically for neonatal survival in this country. So once that PC1 is done, resources will be put in. These are government resources, and they will contribute to a significant reduction in neonatal deaths in that province.
So in your opinion, there is actually good, positive work being done?
Actions are being taken, but when you look at those actions, the next action or intervention which I want to talk about is what we call kangaroo mother care. Newborns die of very, very simple things. Their temperature, they are exposed, so they will die of cold. They get infection, for example, through the umbilical cord, and if the proper medication is not applied, like now we propose application of chlorohexidine, if that's not applied, they develop infection and will die. If the care at home in terms of hygiene, hand washing with soap and water, exclusive breastfeeding does not take place, then you get those newborns getting stressed and might develop complications. Newborns die of preventable conditions, conditions which are easily prevented. Now, when we talk of those interventions and moving forward, our role as UNICEF is to provide the technical assistance. And the provincial governments with the federal governments pick that up to scale up. Now, the issue is that those interventions, actually the interventions to save newborns are all being implemented in Pakistan. But the scale may not be sufficient in terms of large scale to make the big difference. And that's where, as a partner agency, we are working with the government, we are working with the federal level, with the provincial governments to encourage investment from government, from other donors, so that those beneficial interventions are taken to scale and they make the big difference. I gave the example of a province which is already developing a PC1 for neonatal survival. I'm giving a second example of the government developing a PC for prevention services. And when I mean prevention, these are messages which are beneficial, which will reach everyone in Pakistan,
Right.
which will benefit the mothers, the caregivers of newborn, in terms of the simple actions that they need to take to ensure that their newborns are protected, prevention measures, like including initiating immunization, are put in place at the right schedule and at the right time. So we are seeing this happening.
Okay.
And we will be very happy
That's
to
a good
support
sign, sir.
so that it moves
Well,
moves forward.
Dr. Kennedy, I'll come back to you, but I want to ask Dr. Saqlain this question. When we talk about the population bomb, the explosion of Pakistan's population, 207.8 million people, according to our last census. Now, that is also a burden on the economy, but what would you say about that? I mean, we have 1 in 22 children dying, which is one of the highest mortality rates, but at the same time, we have one of the highest growth rates in the population as well. So how do you see both these seemingly very strange opposing statistics, and how do they affect Pakistan's economy?
Sure. I think very rightly you said that that's really a bomb that we are increasing so high a population, and the new census that has given us information that
Since 1960, it's a 54% increase.
But I think there is some balance if you see the overall, although the official report that has not been shared still. But you see some provinces, they have not increased, rather they have decreased their population. Maybe I believe that some migratory population would have given this increased numbers. What I think about is. And I think what we are trying to do, if you come to that topic, because we are just looking about how to protect these highest population in the country, one of the highest populated country in the region even. So I think Dr. Kennedy has said very well that the tetanus is the immediate cause of the death of the children and the mother. As you know, we have already discussed regarding this deliveries in not really required atmosphere. So I think the tetanus elimination that has been done in Punjab, and we are following the other provinces, that would have been done in the next mid of the next year. So that would support certainly to decrease this rate of infant mortality. And secondly, through this immunization, I believe we can save a lot of lives without any cost intervention, because you know this is already being provided by the government of Pakistan free of cost, and this awareness needs to be disseminated to the mothers and to the caregivers that this vaccination is available free of cost, which saves from the 10 deadly diseases. Now the EPI program, I can assure you, that has improved a lot from the last many years. These 3-4 years, I believe, is a blessing in disguise, because the vaccination is a process, vaccine availability is a process, then to make it put in an atmosphere that is required, it's a particular temperature. So in the country, we this time have the best system of the cold chain maintenance and the delivery of the vaccine to the provinces and the districts. So I think we are trying to improve the supply side. Now we have to give bit attention towards the awareness and the demand side.
Absolutely. That is going to be my next question to you, Dr. Saqlain, that how effective has Pakistan's family planning campaigns been over the years, and similarly the awareness campaign that you're talking about vis-a-vis vaccination, because we also can include the question of polio and polio vaccination that has been going on in Pakistan. That's, I'm sure, also part of your subject. So having seen all these schemes in the field, what are your impressions about the awareness campaign? Do you think it's up to the mark, or do you think there's a lot that needs to be done in terms of creating the right kind of awareness and informing and educating the people and the masses?
Thank you very much
do we
for
do
this.
in that?
You know, a very important and vital question regarding this awareness, because I have been talking about, to improve the demand generation basically. I think the program had been working at the federal level, which has been devolved after the 18th Amendment, the primary care and the family planning program. But I think the provinces, they are working very well, looking at the family planning and the
Are they working well, sir? Because over
Yeah,
the past
I think
decades,
past
it seems that they're not working well. If you look at the population figures, they contradict the statement that they're working well. They don't seem to be working well.
What my opinion is that if we had been going through this process regularly of the census, so this would not have been such figures.
Okay.
As we have a long time,
This
for
has been
processing
a-
the census, so now we are looking at some huge figures coming in.
Absolutely.
Rather, we were expecting that. It's a many years.
Right.
I think
19 years to be exact.
Yeah, 90 years. I think these figures has been increasing year by year, and we expected already that. But the family planning program, day by day, I can give you the example of the best focus and highest commitment of the political side. And then, if I just give you the example of Balochistan, for the EPI program in year 2013 and 14, they allocated only 800,000 Pak rupees for the program. For year 16 and 17, 17 and 18, for each year, they have allocated more than 700 million Pak rupees. So you can see the putting, the focus of the government, the putting in investments in the plans and putting in, the all technical. They have hired a lot of people across the country, and the training programs are in process. So all these factors would certainly support improving this situation of the highest rate of the newborn deaths in the country. One thing more on the polio, I think the best example now to work with the polio is that we have come down from the 308 cases in 2014, and now we have only 8 cases in 2017. So this is the best example of having a multi-sectoral work. We need basically what you're talking about regarding the awareness.
Right.
So this is multi-sectoral basically. We need to involve many sectors for improving the,
Overall health
the
of the
overall
nation.
health system and the awareness to the people.
Right.
To basically the core component, what I believe is of the any health system is utilization of the services by the community.
Right.
Is a trust of the community on available services. So
Right.
this is very important, for the awareness, and we are trying, to have extensive and robust communication strategy to launch in the country. That is in the process. The action plans has been done with the provincial at the federal level. The budgets are available. Now we are in the process to initiate just to have a very extensive communication strategy to look into to improve the this demand promotion, and then certainly inviting the people to come in to avail these services, rather the right of the people to avail these services by the government of Pakistan.
That's very important. Dr. Kennedy, what is the interrelationship between a high mortality, infant mortality rate and the economics of a country? We were talking about this earlier before the program,
yeah.
but if you could elaborate that, what is their interdependence?
Yeah. I think you mentioned the recent population census.
Yes.
207.8 million people. That's human capital.
But it can also be a burden.
No, let me start. It's human capital.
Okay.
It only becomes a burden because of the quality of the population.
Right.
And that is the interrelationship between population, fertility, and economy.
Right.
Now, the closest, all the relationship is on early childhood development. I've been listening to the news in Pakistan, especially news touching on the economy. And it's very clear that Pakistan is setting itself for knowledge economy, which means having populations of people who are intelligent, smart, who will drive the economy to the next level.
Right.
But for those generations of populations to come, what happens during the early childhood development, which starts during pregnancy.
Right.
It does not start after delivery.
So more important is the mother's health.
It starts during pregnancy.
Right.
And then that continuum continues to delivery. So the matter, in terms of empowering them with education, their literacy level is key. Empowering them with the right knowledge to know what to do during pregnancy, during delivery, and the steps to take in case there are complications. That's the essence, that's the core of early childhood development.
Right.
And now, when the children come, or when the newborns are born, the the environment during those early stages in terms of stimulation, in terms of bonding with the parents, in terms of the general environment and the exposure, because that's the time when the brain is developing at its most rapid rate.
Right.
And that's actually when the brains develop.
Absolutely.
So when that period is taken care of well by a country for those newborns, then the generations which follow are generations who will do well.
And subsequently, you're improving the quality of your individuals in
and
the
subsequently, there will be human capital.
Yes.
And that's the biggest single contribution to the economy. Let me put the numbers into perspective.
Please.
Following the population projection, which we are still using, because I'm not sure whether the census is still official, the 2007, but following the projections which we have always used, we are expecting about 7.1 million women to be pregnant in Pakistan at any one time in a year. And those 7.1, actually, the deliveries, live births, about 6.9, which means 7.1 million women pregnant, but only 6.9 deliver live births. So there's about 200,000 stillbirths. Basically, these are newborns who die before delivery.
Right.
Now, the 6.9 million, after 1 year, we are talking about 6.4 surviving infants.
Right.
Which means another 0.4 or 400,000 children dying during that period. But we know that actually a majority of these children die during the first 28 days of life.
Right.
A majority, about 60% of them die during the first 28 days. And that's where this report comes in. So when you follow that continuum, and immediately after delivery, you are following the discussion on family planning. We talk about postpartum family planning or postpartum contraception. Immediately, a mother delivers, she's supposed to be encouraged to take up a method of contraception based on choice.
Right.
And based on religion and other issues. The reason for that is to allow for part spacing, so that the duration between that delivery and the next pregnancy is extended as much as possible.
Right.
That we know contributes to child survival. It contributes to the health and survival of the mother. It contributes to the population.
Absolutely.
In terms of
lowering the
rate at which the population is growing.
Right.
And that contributes to the economy.
Absolutely.
So these are the two aspects on how the fertility, the pregnancy, the issue we are talking about
Right.
relates to the economy. First, through the family planning contraception angle,
Right.
part spacing, and secondly, through how we take care of those pregnancies, how we take care of the delivery and the time around delivery, and how we take care of the children under the age of 1 in terms of ensuring that they survive the first 28 days, and for the next months till 1 year, that they go through the full course of immunization, the enabling environment in terms of hand washing, soap and water, food, exclusive breastfeeding, everything is in place. And that brings me to the point which I wanted to make, where again we are seeing some positive action from the government of Pakistan, and that is in relation to quality of care.
Right.
So the quality that we provide, the quality of care we provide during this stage of life, during pregnancy, around the time of birth, immediately after delivery, and the period till 1 year, is critical and very important, even for the high mortality that we are talking about. Because in Pakistan, as you said, and as Dr. Gilani has said, the facilities are there. The hospitals are there. Most of the district headquarters have a district headquarter hospital with doctors. This is one of the countries where I've gone to a basic health unit and I've found doctors lower at the level of basic health unit. This is
in the villages.
In the villages.
Right.
This is basically one of the very few countries where you find that.
This is a new phenomenon and a very welcome one, I must say.
So the main issue is what is the quality of care that we provide at these critical stages.
Right.
During pregnancy, the time around delivery, and immediately after. And because of that concern, actually the Federal Ministry of Health, through its mechanism of the high-level health and population think tank, already put that matter for national dialogue in 2017 and came up with a policy brief which we were involved as partners. And that policy brief is very clear that quality of care around the time of delivery, we need some institutional arrangements. The provinces needs to have a mechanism and strategies for taking care of quality of care around the time of delivery.
Okay.
Including quality care for immunization services.
Right.
So, and that dialogue is already being stepped down
All right.
to the provinces through the provincial health commissions. I'm aware that there is
And you see actual practical work taking place on the ground?
Yeah, so action is moving in terms of dialogue, in terms of policy, the guidance, and then getting into the actual work on the ground through the provincial health commissions, because they are in charge of the minimum standards,
Right.
they're in charge of the guidelines, they're in charge of quality.
Okay.
And that's where, as we say, the tire meets with the road,
Right.
where the action needs to be.
All right, we need to take a short break over here, sir.
Okay,
And
thank
when
you.
we return, we'll continue our conversation and talk about other aspects of the health of pregnant mothers and then, of course, the children that are born to them. So we'll just take a short break right here. And when we return, we'll continue our conversation. We'll be right back. Welcome back after the break. We're in conversation with Dr. Saqlain and Dr. Kennedy about infant mortality rates in Pakistan. And let's continue the conversation. Dr. Saqlain, I wanted to also ask you regarding the figures of children that are born prematurely in Pakistan. That is also a significant number as far as I know, but unfortunately we don't have statistics on how many children are born prematurely as a result of poor maternal health. So if you could talk about that.
Thank you very much. I think that's very right that we don't have actual figures on that, and I think the process has been started for collecting these figures so that we would have some policy making on looking at the premature babies. And I remember one of the program, IRMNCH, that's working very well in the country, and that has been supervised and supportive supervision have been provided by the Federal Ministry of National Health Services. I just want to extend over here to look at the immunization in the Pakistan. You know, we have been catering why the program names is expanded program, because we have been expanding year by year this program. We started in 1978, and we have been expanding this program up to the 10 vaccines. Now we are giving 10 vaccines to the children against the vaccine preventable diseases, which is very cost effective intervention, and that can make the children safe. You know, we're talking about the under 1 year deaths of the children, so that can make safer and safer the children under 1 year of death. The most important causes which has been talked about is the tetanus in the newborn and the mothers, and second, the most important, although the other causes are there, but the important cause is pneumonia. And we have introduced a pneumonia vaccine in 2012 that has been scaled up throughout the country and is available in the routine immunization schedule under the EPI program, and that confers the 90% immunity against pneumonia. So that's, you know, can make the people to come in and avail this opportunity to save their children through this deadly disease of pneumonia. Thirdly, we have introduced a vaccine which is very important cause of the death of the children is the gastroenteritis caused by the rotavirus. So massive diarrhea comes in, and then dehydration, shock, and death of the children. So we have introduced in 2017, which is being scaled up in all the country, rotavirus vaccine, which is against the rotavirus infection. So that would again make the safety of the children against this deadly disease. So although we have 10, but we are looking at to expand somehow. That discussions are in the process with the donors and the partners. If we go for some more vaccines like typhoid vaccine or some vaccine in the women to just look at the rate of the deaths of the women through the this carcinoma of the cervix, that would be saved through the vaccine introduction of the HPV. So this all processes are being taken up by the government of Pakistan and being supervised from the Ministry of National Health Services and trickling down to the provinces, so that we could have a comprehensive, we could have a concrete system of protecting the children and the women against these deadly diseases.
What kind of response have you received from the masses when you talk to them about getting these vaccinations for their children? Of course, income disparity also plays a part when it comes to healthcare. So in your opinion, how effective has your message been in how many people are able to benefit from the programs that the government has initiated?
Yeah, thank you. This has been an issue regarding the fully immunized coverage children, but we have the data from the last time. So we are improving day by day. So as we are improving day by day to have the FIC coverage in the country, so certainly we could estimate the people who are availing the services. I think the advancement of the media, that has played a role for this, improving the awareness and the demand of availing the services. I can give you an example of when we introduced this injectable polio vaccine, IPV, in Balochistan. We started from Balochistan. So that was a very good response from the people to come in and avail this opportunity against the polio disease for their children. And I think the masses, they are really now thinking about to avail these vaccination services by the available by the government of Pakistan in terms of economy, in terms of financing. So that has been already conveyed to the message that this is free of cost. These are the thousands of vaccines which are being provided to the children and to the mothers, pregnant women, free of cost at the health facilities available in the public sector. But there is again a question, what's about the status of the private sector? So this initiative has been taken by the ministry through the federal EPI program, that we are going to launch public-private partnership, because a big sector in Pakistan, if we look at the system of the health in Pakistan, the people are availing more services because of the low trust of the community on the available service of the government, availing the private sector services. So we are now launching the public-private partnership with some good organizations, and then trickling it down to the minimum level at the ground, so that we could avail the opportunity to provide these services to the private sector also.
And is there a monitoring mechanism on the federal level which also oversees the work being done by the provinces? As Dr. Kennedy was also mentioning, that after the 18th Amendment, it's been devolved to the provinces. So is there some mechanism that overlooks the entire process?
Yeah. This is basically very technical, but I just want to, I try to explain if my population or my nation would understand this. This is a bit technical, that after the devolution, this was really an issue, particularly for the donors and the partners. How could we have the monitoring and accountability framework which would be trickling down to the district level? So initially that was an issue, so we went for discussing the roles and responsibilities of the federal government and the provincial government, so that would be agreed on some legal forum. And so we follow those responsibilities, and we remain in those mandate to work with. So at the federal level, the surveillance of the diseases and the monitoring of the all program retained at the federal level with the federal EPI program, and the rest of the implementation and the technical issues that would transfer to the provinces. But the coordination mechanism would continue, so that we would have the agreed decision and the agreed mechanism to work with the immunization program. So we took an initiative in 2015 to have EPI reviews, expanded program and immunization reviews, biannual at the federal level and then quarterly at the provincial level. So that's a forum which we had a coordination. We are having a coordination with the provinces to look all the program on one page. And secondly, we are now have the exchange trainings and exchange programs with the provinces, within the provinces. So we invite the provinces from the people from the other provinces to look at the achievements and the practice of the other provinces. So this could be, playing a vital role to have one page, and concrete plan to implement in the country, and secondly, certainly the accountability framework overall in the country. And I finally would just put a light on that the EPI program in the country has the best example of coordination in the country, because the donors coordination stays with the federal EPI program. The introduction of the vaccine policy making strategies stays with the EPI program at the federal level. So we are trying to supervise and oversight all the provinces through two forums which has been agreed. One is the Interagency Coordination Committee, which oversight overall program in the country, and secondly, to have a good coordination. We have now the Interministerial Committee to work with and to have a good coordination within the provinces and with the federal government, with the donors and the partners.
Okay, Dr. Kennedy, in your experience working with the government, as Dr. Saqlain was explaining it, do you find it to be the best possible method that is being employed by the government in conjunction with the UNICEF? How do you find the work being done in Pakistan? Is it up to the mark?
I think let me start by saying that if you look at all the investments which are being made into the health sector, into the immunization program, most of those resources are coming from the government of Pakistan. The development partner, UNICEF, comes in as a technical agency.
Just as support?
Not the resources, but
right.
Technical agency. Which basically means, as UNICEF, working with government, leveraging on government resources, influencing government policy in terms of allocation of resources to areas which make the greatest difference.
What kind of political will have you witnessed within Pakistan when it comes to dealing with the problems in the health sector?
Yeah, I think Dr. Gilani mentioned the issue of polio. Polio was given top government priority right from the Prime Minister.
Right.
Through the chief ministers, the commissioners, deputy commissioners, assistant commissioners, to the Union Council. Top government priority next to security or such high-level matters.
Right.
So that's first commitment. And then next to that, right now we are seeing increasing interest on routine immunization from government. It's being prioritized. Resources at provincial level are being increased for the immunization program. So we are seeing that prioritization of immunization program, which Dr. Gilani has spoken about, coming up. The next area is on neonatal survival, the subject matter of today.
Right.
And there too, we are seeing government interest in addressing that matter. It's only the issue of neonatal survival strongly depends on health system and a strong health system to save the mother and to save the newborn.
Right.
And making investment in those systems requires resources. It requires the people, as we said. The spaces needs to be there, and the demand for those services also needs to be there. All needs to meet
Right.
to make the difference. And we are seeing those differences. When you step down to the different provinces, we are seeing some provinces investing massively into the health sector. We have seen provinces taking accountability, accountability.
So all the indicators, in your opinion, are
in
positive?
Measures. So those are measures. And those measures, we know they are being made because it's making the difference in the health sector requires huge investment. It requires very clear focus in terms of the policies, the investments.
Right.
And the tide is changing that way. Initially, the priority was on polio. it's taking up the routine immunization. We are looking at the neonatal survival and maternal survival coming up as well, so that that continuum is complete.
Right.
And we are seeing positive actions in
Now
that
what we'd
direction.
like to see is some serious concern to be showed in the education sector as well, because they're all interrelated. And I think educated mothers are very important to have healthy children.
Actually, education is the key, because anywhere in the world, the evidence is very clear.
Well,
If you improve the education status of women, of the mothers, of the young ladies, neonatal mortality, maternal mortality, childhood mortality decreases.
Well, you just said it. Education is the key here.
Yeah.
And we leave it at that because we're completely out of time now. But thank you very much for taking out the
thank
time and sharing your knowledge with PTV World. And we hope that our audiences also did get some benefit from that. Well, you heard the conversation, and always prevention is better than cure. And we hope that this program was informative and that you were able to make the right decisions when the time comes for your own deliveries of your own children. So on that note, it's goodbye.